This episode of That Podcast in Hutch is brought to you by me. If you'd like to learn about how you can sponsor future episodes of That Podcast in Hutch, please reach out to me at thatguyandhutch@gmail.com or through my social media channels, which are also That Guy in Hutch. Thank you. Hey everyone, this is That Guy in Hutch, Jason Probst, and you're listening to That Podcast in Hutch. I have to tell you, I'm excited about this episode for a number of reasons, but the main reason is that I've brought in today people from the Hutchinson Clinic, specifically Julie Schott, who is the person who looks at like the really intricate details of reimbursement and dealing with insurance companies at the Hutchinson Clinic. And one of the reasons I really wanted to get her in to talk about what's going on between the clinic and Blue Cross and Blue Shield is because it's created so much kind of confusion and some angst in the community about what's going on and what people can expect from their health care. And I know there's been a lot of chatter online, a lot of talk online about who's to blame, whether it's the clinic's fault or whether it's Blue Cross's fault. I think I've been pretty clear about my position that like we are dealing with a system problem. We all engage healthcare in one way or another, whether it's simply going to our doctor for a checkup or whether it's going to the emergency room because somebody in our family or ourselves has had an accident or something. But the bottom line is that I think most of us agree that the healthcare system is kind of this very complex, very hard to understand, and frankly, somewhat inefficient system that puts a lot of burden on patients. And we might disagree, or there might be plenty of disagreements or plenty of ideas about how best to address that issue, but I don't think any of us, or not many of us, think that the healthcare system that we exist in is working and functioning very well for patients. In this case, I wanted to bring the clinic in because they're a local entity that has had a presence in this community for a very long time. My doctor's at the clinic. Probably most of my listeners have a doctor at the clinic, somebody that they've built a relationship with, somebody that they've gone to see for a number of years. And so I think part of my role in this position is to give people an opportunity to come in and tell their side of the story. And that's what I'm trying to do here today with the Hutchinson Clinic, is to have them come in and tell their version of the story about what is going on in this situation. I will tell you that I have every plan to offer that same courtesy to Blue Cross and Blue Shield. I will gladly sit down and visit with them and give them the same amount of time to come here and explain their side of the story. I've asked a number of questions of both the clinic and of Blue Cross Blue Shield, and every time I've gotten an answer from them, I've tried to share that information with people in a responsible way. And I'm more than happy to sit down with Blue Cross Blue Shield and get their version of the story, because I think it's important to have that information out there, and then you're able to listen to that and make your decision about, how you feel about that or what you think, or about what decisions you should make for your healthcare. But I found this conversation today with Julie very enlightening. It brought to light some things I didn't know about the negotiations between the clinic and Blue Cross Blue Shield. It brought to my thinking some ideas about what some of the problems were and some of the barriers that the clinic has in dealing with a giant insurance company like Blue Cross Blue Shield. But ultimately, I wanted to give them an opportunity to sit down and try to clear the air about some of the things. There's been a lot of things online, a lot of conversations about what's going on and what this means for patients. And I try in this hour or so that I spend with Julie to get to the heart of like, what does this mean for patients? What can they expect? I try to get them to tell the story about the experience of what they were dealing with from their perspective, why they felt separating from Blue Cross Blue Shield was necessary, what they felt Blue Cross Blue Shield was doing wrong by them. And I think if you listen, you'll learn some information. You may not agree completely at the end. I still at this point, I'm kind of the mode that like there's blame to go all around and that there are just fundamental structural weaknesses in the system. And that maybe things could have been dealt with differently on both sides. But I walked away from this interview feeling far more informed. I felt like I got a deeper understanding of the clinic's position on this. And I think it explains why they took the measures that they did, which, earlier in the months previously felt quite a bit drastic. And I know it created a lot of concern for people. And then there's still a lot of concern about that. But I think this was an experience where I was really glad I got to have this, because having them in to talk about this, to explain why they did what they did, and some of the more detailed information about why they felt it was necessary is really critical in understanding the broader picture of what they're doing. So I hope you'll enjoy this conversation with Julie. And I will say, I talked to them after we finished recording, and I left open the possibility that there's probably a number of questions I didn't think to ask during this interview. And they are completely open. Julie was completely open to fielding questions afterwards. So if you listen to this episode and you feel that there are questions you didn't get answered, or you have other things that you want to convey to the people at the clinic that maybe I didn't think to cover in the middle of an interview, don't hesitate to reach out to me. You can email me at thatguyinhutch@gmail.com, or you can message me on any of my social media platforms. But don't hesitate to reach out to me and let me know what you wanted to know, because I've kind of created an open door here where I think they'll answer the questions that I submit to them, because I do think that we're trying to get this information out to the community. So with that, if you have questions, get a hold of me, but I'll let you get to the interview with Julie, which I think you'll find very informative and very helpful in getting a better understanding of what's going on in the healthcare landscape in Hutchinson. All right. Well, today I have in the studio with me Julie Schott, who is, and I have to look at this to make sure I get it right, she's the medical reimbursement specialist at Hutchinson Clinic. And I think it's just let's get the elephant out of the room right away. There's been a lot of talk in the community about the clinic and Blue Cross Blue Shield. And at the end of the year, this is it. Blue Cross Blue Shield is not part of the clinic is out of network, and Blue Cross and Blue Shield and you are kind of having this contract negotiation. And the bottom line is that a lot of people individually are affected by that one way or the other. They either had to make a decision to keep Blue Cross as their insurance company and then deal with what comes with their local provider being out of network, or they had to make a decision to go out to another provider. So there's been a lot of confusion, a lot of back and forth. And I feel like people really didn't understand what's going on or didn't have some clarity. So I thought, let's just get somebody in here who can talk about this. And you're the one who I either drew the short straw or you have most of the information that people need. So thanks for coming in today.
Yeah, thank you so much for having me. I feel really excited to be here, and I hope I can shed some light on all the confusion and things that have happened in the last 6 months.
Okay. Well, let's start with just a real simple question. What is the difference between being in network and out of network?
Yeah, absolutely. So anytime that you are working with an insurance carrier, it is their goal to go out and set up contracts with doctors that they want to work with. And so when a doctor sets up a contract with an insurance carrier, that means that they're in network. So generally speaking, some of those terms will include what the reimbursement or payment rate is going to be for that provider or doctor to have those services done, and also what the insurance is required to do as far as paying claims on time and resolving appeals and things like that with providers. So when you have an in-network provider, they have agreed to the terms and have agreed to have a relationship to work with that insurance carrier to resolve those problems as per the terms of the contract. Now, when you have an out-of-network provider, what that means is that provider has not set up a contract with that insurance payer. So they do not need to accept the payment arrangements or rates that an insurance provider has set forth. And that outside provider also can do different billing operations because they're not under those same terms. Now, most insurance carriers do work with both in-network and out-of-network providers, especially here in rural Kansas, because there's a lot of gap coverage. You may need to see a specific specialist that may not be in a contracted position. So a lot of times there will be some back and forth between in-network and out-of-network providers, but an insurance payer is always going to want to have you see an in-network provider because they've got those relationships, they've got that situation where they're able to set the rates, and so that partnership is more stable for both that doctor and that insurance carrier. But an outside provider, they're going to try to dissuade patients from going to an outside provider because they don't know how much that outside provider is going to charge. They don't have to follow the same terms that have been set. And so that involves a little bit more risk for them as a business. Okay. So that's why they tend to prefer an in-network provider versus an out-network provider.
Okay. So at the simplest term, it's just basically like a doctor and an insurance company have said, this is what we've agreed to. In-network provider says we agreed to this. And everybody kind of knows what to expect in that arrangement.
Yes.
Okay. And out of network is, you still work together, but you say we have to kind of fill our way through this because we don't have an established relationship. We don't have a contract, right?
Yes.
Okay. So knowing all of that, why did the clinic want, or I guess how did they come to the decision to go out of network?
Yeah, I think it is related to several different factors. And for me personally, I've worked at the Hutchinson Clinic for 5 years. In that time, I've become a certified professional biller and a certified professional coder. So I have seen the operations of insurance inside and out throughout the organization. And I think we've just seen through my time, I've seen a lot of different changes happen and policies implemented. And so one example is, I actually started in the business office. I think a lot of people recognize that front desk where you go when you have a patient concern. I worked there for a long time. And one of the things that came up time and time again was people being confused and not understanding their insurance benefits and coverage. The number of times I had to explain to someone, yes, this is a service that your insurance covers, but you have a deductible that needs to be met before your insurance will start to cost share. That's a really difficult concept because that deductible is something that you've agreed to pay up front until your care is going to be paid by your insurance. So I think just in that position, I just saw more and more frustration from patients because we were seeing deductibles continue to rise higher and higher and higher each and every year. Mm-hmm. After that, I moved to a position at the Hutchinson Ambulatory Surgical Center. I did transaction processing. So basically what that is you look at each claim and then you kind of enter data about how the claim was processed from the insurance carrier. So, whether it was approved or denied, there's a code for everything. Mm-hmm. The most common one that we see in general, because we have a lot of insurance contracts, is, there's a difference between the standard fee rate and the contracted rate. Mm-hmm. So when a provider or doctor is setting their prices for a service, they're going to say, okay, the price for my service is $200. Well, when you have a contracted arrangement with an insurance payer, that contracted payer can say, well, you may be billing for $200, but we are actually only going to pay you $150. So for every time you bill that $200, you have to write off that $50 right off the top. Mm-hmm. So again, that's the most common thing that we see because we just, have a lot of contracts. But one thing I noticed about Blue Cross Blue Shield with their HASC billing process.
Wait, what does that stand for?
Oh, thank you. Hutchinson.
Yeah. If you use acronyms, I'm going to stop you because nobody outside of your industry knows them.
Yeah, absolutely. So when I was entering Sorry, let me pause. When I was entering information for the surgery facility about the claims, I noticed that Blue Cross Blue Shield would pay a large sum on the primary procedure, so the biggest, most expensive part of the procedure, but then they would write off any other procedures that happened, and they were the only payer that did their adjustments like that. So that was just kind of an interesting observation. And then finally moving into my current role, where I do kind of look at these contracts and I do look at how these different payers are setting their payment rates for providers, I just noticed that time and time again with every service, Blue Cross Blue Shield was consistently below the rates that we were getting paid by other commercial contractors in this area.
Okay.
And so that's just from my perspective, but I think that we've seen kind of everybody in our organization has seen those kind of differences across the organization. And so, I think one of the big questions that our physicians continue to ask year after year is, where is all this money going?
Yeah.
Because what we're seeing, both in the business office and day to day, is patient deductibles continue to increase year over year. So more patients are paying for their services up front before there's any cost sharing by their insurance. Then, we're also seeing patient premiums increase year over year. I mean, in our own plan, we saw that. And, that was one of the reasons why Hutchinson Clinic decided to move their insurance policy from Blue Cross Blue Shield to Central Plains Physicians Health Plan, because we were just seeing that raise in cost year over year. We are also seeing just medical costs in general rise. I mean, that's for supplies, that's for equipment, that's for staffing. I mean, that's just to be able to make the actual medical services happen. Even with all those changes, though, we really weren't seeing much change from Blue Cross Blue Shield. We were seeing that the reimbursement rates were staying the same, maybe going up a little bit, also decreasing. And it just wasn't, the numbers weren't adding up. If we're seeing all these different costs rise, but the amount that we're getting paid the same, there's a disconnect.
Yeah. And it sounds like I want to make sure, so I'll do this a lot because I want to make sure I understand what you're saying is it's not just an across the board and this is one of the issues in medical care. I think most patients are familiar with the dance between what a provider charges and what an insurance company says they'll pay, and they can look at their bill and they can look at what they get from their insurance company and see that difference. But you're explaining a different situation where a comprehensive thing has been done, and then the Blue Cross Blue Shield is saying, we'll pay this much for this, but zero for this and zero for this, and maybe a little bit for that, but in the totality, you couldn't do the procedure without all of those things. Am I understanding that correctly?
Well, in the case of the surgery center, again, that's how they bill for facilities. There's a different process they bill for, for doctor services. So I want to make sure that's clear.
So what was the response then? Did the clinic go to Blue Cross and say, hey, this is an issue. We need to fix this problem?
Absolutely. We've gone to Blue Cross several times to demonstrate that the costs that the rates that they're paying for some of our services do not cover the cost of what we're actually providing. We have done that for allergy services time and time again. We've done it for radiology. We've done it for lab. We've also done that a lot for drugs. And so it's really hard when we're like, this is our invoice for this service. Why are you paying us this? And we're told that's the contracted rate. There's nothing that can be done about that.
So in some cases, I mean, I've heard about this with pharmacy benefit managers where they're that's a whole nother, I'm actually going to try to do a whole nother episode on that, but where we know that pharmacies are being paid less than it costs them to procure the drug. Is that happening here? Are there instances where the reimbursement you're getting from Blue Cross Blue Shield is either at, below, or very little above the actual cost of delivering that service?
Yes, that's correct.
Okay. And so I'm assuming then, and part of your conversation with Blue Cross is this isn't something we can keep doing. We can't keep doing a thing for zero money.
Exactly. Yeah, I mean that's exactly what the problem is the cost of medical services continue to rise, the cost that's being placed on patients continue to rise, and just the rates of payment aren't going anywhere. And you're right that isn't sustainable. And honestly, I think it's a combination of all those different factors that led us to cancel the contract.
Okay. So are these sort of like, to us, this is the first time we've seen something of this magnitude where there's a big kind of a fight between a health clinic and a like a big insurer like Blue Cross Blue Shield. But is this sort of negotiation something that happens? Is it common? Okay.
Yeah, absolutely. No, I mean, insurance negotiations happen frequently and consistently. And honestly, it's just like any normal business relationship. It starts with a discussion. What we do is we evaluate what has changed about Hutchinson Clinic since the beginning of the contract that was set and where we're going forward. So, for example, if we're getting ready to start up a new line of business, we will let our insurance payers know about that so that they, are able to make those services readily available to the patients. If we're getting ready to retire something, we're also going to be in communication about that. So we do try to work on situations that are going to be a good compromise for both parties. Like, for example, this last year we just brought in a new plastic surgeon. Well, Hutchinson Clinic hasn't had a plastic surgeon for 15 years. Mm-hmm. So like those services weren't something that we were really considering, within our contracting standards. But once that became available, that became a priority. Now to make, more accommodations for that particular specialty, we did have to make some other changes in other departments. But ultimately, it's a back and forth. It's a give and take. And that is normally what contract negotiations look like between a doctor and an insurance payer.
So then on that situation, you would have to, again, a lot of this is to make sure I understand it correctly. And we could just pause and say, like, the world of healthcare it's incredibly complex, right?
Oh my gosh, yes.
It's like layered. There's it's one of the most heavily regulated industries that's out there. You have all these like third-party payers that are involved. You have providers. You have patients. You have like federal standards. CMS is involved. All these different people have their hands in healthcare, and I will be honest. Like, I get incredibly frustrated because it's like, look, I just have a thing that I want taken care of, and I want to know how much it costs or it will cost, and that's all I want to know. And that's a hard answer to get to because it's very complex. I mean, I think there are structural issues that we could take care of in healthcare, but beside the point. But one of the things, so I guess I want to make sure that when you stand up a new thing like a plastic surgeon, that's not part of. Like, do you have to go back to the insurance company at that point and say, hey, we're doing this thing now and renegotiate that with them and figure out what the reimbursement will be on that? Or I'm having a little trouble understanding that.
I mean, we don't have to go back every single time that there's a new provider. That's just kind of an example that I gave. But I mean, we look at our contracts regularly and frequently. And so that might be a consideration we would make, when we were making our arrangements with another insurance commercial payer. So the goal is to come up with something that works for both parties. Yeah. And so, some years we may prioritize a specific service, because we know that that's going to be something that's really needed in the community, and we're not going to worry so much about services that we don't offer. We're not going to worry about the payment rates that we're going to get for a specialty that we don't offer. So that's kind of an example of just kind of how we focus our attention when we're having these discussions.
But I'm not trying to belabor. I'm just trying to make sure I understand. But if you had, if you knew and all the data indicated you were going to have a huge demand for cardiology, you would want to make sure that the reimbursement rate on that was better.
Yeah.
Than say plastic surgery, which may not capitalize very much.
Right. No,
Right.
we're always checking to make sure that the reimbursement rates are covering the cost of the service itself and also contributing to the overall operating budget of Hutchinson Clinic and everything that it invests in, of course. But, but at the end of the day, again, it's a compromise. There are things that, I will make a list of asks. They will make a list of asks. We'll kind of agree on a general set, and then we send it to the legal teams to write the contract.
To write the contracts up and say this is what they've agreed to.
Yeah.
So when these contracts are negotiated, I mean, have you been part of these negotiations before, or I mean, is this different than what you've seen the way this is unfolded this year?
Yeah, I've been participating in these kinds of negotiations since 2022, so I'm pretty familiar with them. But really, I think the thing that was different in this case is with Blue Cross Blue Shield, their contract terms are you take this or you leave it. There's really no in between. And I think that was kind of surprising when we first started these conversations. Because essentially their terms are, this is your fee schedule. This is what we're going to pay you for your services. This agreement only lasts for 1 year. I mean, there is an auto renewal policy. But also, really once that agreement has been presented to you, there are no changes that are possible at that point. So unlike working with another commercial payer where, again, there's a give and take back and forth, we kind of can both run our own financial projections to see where we're going to end up and make sure it's good for both parties. Blue Cross Blue Shield, it's a very one-way direction. Either you have this option or you don't.
So one of the things that Blue Cross, because I did have some conversations with Blue Cross earlier, I guess later last year, they said you guys made the decision to cancel the contract before you ever saw the reimbursement rates. Can you answer that?
I absolutely can. And really, I think it's important to go over the whole history of our negotiations to fully understand the answer to that question.
Do.
Okay, great.
Please do.
I'm so ready to talk about this. No. So, I mean, really, negotiations with Blue Cross Blue Shield began in 2023. So we were following the standard process. Normally, we receive the fee schedules in the summer. We have time to review the fee schedules, and then we have to provide our decision of whether or not we want to terminate by the end of or the beginning of September. It's usually that first Monday after Labor Day. So we were following the normal process. And this year I was really excited because my provider rep was like, "Oh, Julie, I got the reimbursement scheduled to you as early as possible because I know you're really into that stuff. You're really into the data. So I wanted to get this for you right away." So I got it on July 8th, which was just amazing. And I was really, really appreciative of that. So I did my analysis. I ran through all my models and things like that. And what I noticed was that the rates that we were getting for 2024 were not good for Hutchinson Clinic. We were going to lose money on a lot of the services that we are the only people who offer in that region. And so I was concerned, and I brought that up to our rep, and then we brought that up to other people in the Blue Cross Blue Shield organization, and we had a lot of discussions about it because, we were worried about how this was going to impact us. And honestly, I feel like Hutchinson Clinic brought a lot of solutions, but essentially Blue Cross Blue Shield said, "No, that's the contract. These are the terms. It's been set in stone at this point. There's nothing else we can do." And I mean, what was challenging for us was we had actually, and by this time we're talking like somewhere in the fall, we're at this point in the conversation, and we had already pretty much set our employees to go on Blue Cross Blue Shield for their insurance in 2024. And we knew that a lot of other businesses were also in that situation. So, for us to take it or leave it, we were going to disrupt all the businesses who were already locked in. We were going to disrupt our own employees who were going to be out of network for the very services they provide themselves, which doesn't make sense. And, in our conversations, Blue Cross Blue Shield said, "Okay, well, we understand where you're coming from. We'll work with you on 2025. And so we took that in good faith that they were going to try to develop something that was going to be beneficial for both organizations. So between not wanting to disrupt the businesses in 2024 and their promise to work with us in 2025, we decided to accept the 2024 contract. And
even though it was net not going to be profitable.
Correct.
Yeah. Okay.
Correct. Because we felt that was important. And so, when negotiations came up again for 2025, we actually started way earlier because, again, we were told that everything was done by July. So we knew that we needed to get on the ball with this fast. So in March, we had actually sent a proposal to Blue Cross Blue Shield. And one of the things that we requested was we asked for a 3-year agreement. Because after having gone through, what we experienced on the 2024 fee schedule, and then honestly seeing the financials after that year, we were worried that, okay, well, 2025 might look good, but then what about 2026, 2027? We don't want to have to keep having this conversation over and over. And this arrangement is going to be more sustainable for our business. It's going to be more sustainable for their business. It's going to be better for patient care. Like, this is an easy solution. But Blue Cross Blue Shield wasn't open to that kind of arrangement. On top of that, we had a lot of conversations about the fee schedule, but ultimately Blue Cross Blue Shield was not willing to share any of the rate changes until after it had already been published in July. And so by that point, we're in June. It's a month maybe before we get the fee schedule. The conversation's not going anywhere, and we know that businesses are on a time crunch to start making decisions.
Yeah.
So we really felt like we were obligated to cancel the contract early because we just weren't convinced we were going to get a resolution, by that September 3rd deadline. And so, we wanted to make sure that businesses and patients had an opportunity to actually know that this contract was going to be in jeopardy and be able to voice their concerns to Blue Cross Blue Shield before that drop dead deadline on September 3rd.
Okay. So that explains why you canceled the contract early before July.
Yep.
And you immediately started letting businesses and people in the community know about this, right?
Yep.
Okay. And your thinking was that because you took you took like a less than great deal for you guys in 24, that you'd be able to have that conversation in 25 and set yourself up, I guess, for success in 25 and 26 and 27. Every year you all have to go through this? Is this the case for every clinic in the state? They have to do every single year renegotiate this contract?
Well, again, I don't know if I would call it renegotiating because we get the fee schedule and that's the fee schedule and you take it or you leave it. But yes, we do this review process every single year. So we get the fee schedule, we analyze how it's going to change or how it's going to differ, and then take the next steps. Okay,
this may be a question that I'll have to direct to Blue Cross at some point, but how do they set the fee schedule? I mean, you all are the providers. And there's providers all over the state, but Blue Cross just sends you a list and says this is what you'll get or don't.
That's correct.
Right.
And that's a great question. I don't know how they set their prices. I mean, I think we all have our own special method of setting prices for the cost of services. I mean, that's part of the business, but I don't know how Blue Cross Blue Shield comes to those numbers.
Okay. But that's not something that's known to you, then?
No, definitely not.
Okay. So what seems to the community like this, on the outside, it seems like a very abrupt decision, right? It seems like you guys were just being haughty and you said in June, well, forget you, Blue Cross, had actually been like over a year, maybe almost 2 years in the making.
Yes.
By the time you got that point.
Yes, exactly.
Okay. So I think that's a good piece of information to have because I think that helps. And then when you did make that announcement to people in the community and particularly to businesses, because any of us that have jobs know that you have to start making these decisions, right? There's an open enrollment period. You have to sign up for your insurance. You have to compare charts and data and all the things that you do when you're picking an insurance company. What was the response then from businesses in the community? Did you guys talk to major employers about what you were doing? What sort of things did you guys hear then at that point?
Yeah, absolutely. So we did a lot of outreach to employers because ultimately we knew that they were going to need this information as soon as possible and need to decide how they wanted to proceed and what was going to be best for their business. So we did send out 2 rounds of letters to individual businesses. We also did 2 separate calling campaigns where we contacted the businesses and attempted to speak to someone who would, have a role in kind of this decision-making process. We did obviously use some social media and our own website and, did some other marketing efforts and things like that. So I feel like we did our very best to try to inform people with as much notice as possible, especially, again, before that September 3rd deadline, because, that's significant for Blue Cross because that's when they start to notify their national contracts that all these different changes are going to happen. Mm-hmm. But again, because we know so many businesses do make their decisions much sooner before that deadline, and there is so much work that's involved with open enrollment, we knew that if someone was going to be able to look at alternatives, they would need the time to ramp up to do that. So, we were really glad, honestly, that we did make that decision to terminate the contract early and notify the businesses early, because even when we did end up getting the fee schedule on July 31st, it still wasn't that favorable to Hutchinson Clinic.
Well, this is a good point that I forgot to ask. Did it improve any?
It improved a little, yeah. But again, when you're getting paid just above the cost, it's kind of hard to say, oh, yes, this is going to be a great sustainable solution for us.
And I guess another point to make on this, one of the things you guys have mentioned a lot is that they tell you that this is the same rate that everybody's paid in the state. But am I understanding correctly that there's no real hard evidence of that?
So in the past, each provider has been provided what has been called their comp schedule. And so Blue Cross Blue Shield will give you the code that you bill relatively frequently, the description of that, how much your standard fee charges, and then what they pay on that. In the past, these comp schedules really only reflected about maybe 65% of the services we offered. So from 2022, 2023, and 2024, we really only had 65% of the information that we received. It's my understanding every single contracted provider also receives some kind of comp schedule like that. So that would have the code that the service they billed, the description, their standard fee charge, and what they were getting reimbursed. There is no coordination between providers. We do not ask, what another clinic's reimbursement rates are and vice versa.
Okay.
And let me clarify, when I got the rates in 2022, those were for 2023. When I got the rates for 2023, those were 24, et cetera, et cetera. The first time I got a full fee schedule from Blue Cross Blue Shield with every single service was on July 31st, 2024. In the past, that had not been available to us. That was the one that they sent us. It was de-identified. It did not say Hutchinson Clinic specifically. I don't know if everybody else got that same spreadsheet.
That's the first time that you had seen the comprehensive list of everything they pay for.
Correct.
And for different specialties and everything, right?
Correct.
Okay. So before that, you're making a decision kind of like you said, half information, right?
Correct.
You're just taking a guess that the rates are going to be something you can work with, but you don't know for sure.
Correct.
Okay. So you did this outreach to businesses and you talked to them and you called them. Were they receptive to to your case, I guess?
I think at first, everybody's immediate reaction was stress and fear and concern because healthcare and healthcare costs are one of the most stressful topics. And we completely understand, why everybody has felt, so tense about this whole situation. And so, we did have to do a lot of time to really explain the situation that Hutchinson Clinic was in, where we were at, why we were doing this, and where we were going. And ultimately, it really is for the sustainability of healthcare in Reno County. Because, what a competitive reimbursement, or competitive payment or competitive contract looks like for us, it's a couple different things. One, that allows us to recruit new physicians. Just like every industry, we are at a point where a lot of our tenured physicians are, in the realm of retiring in the next 5 to 10 years. And so these physicians have really busy practices, and to keep those patients taken care of, we need to continue to bring in new providers so that they can take over those practices. If we're not doing that, then patients aren't going to have doctors to see anymore. So recruitment's important, and bringing in those new physicians is important. But to do that, we have to show those new doctors that we actually have competitive contracts and they will be able to pay back all of their medical debt.
Yeah.
So that's very important. 2, we actually do invest a lot of our funds into new technology that's going to produce better patient outcomes and better information for the doctors to make medical decisions on. So one of the things that we brought in 2023 was the PET myocardial perfusion study. Now, what this does...
So, wait. Say that again. Say it to me like I'm 5.
Okay. So... The clinical term is PET myocardial perfusion study. What this is it is a radiology scan that looks at your heart and tracks your arteries and sees if there are any signs of blockage in it.
Okay.
So if you're a patient that is susceptible to heart disease or coronary artery disease, this is a really good service for you, because the alternative is to go and have a surgical procedure done. You'll be put under anesthesia. The doctor is going to go and look in your heart and look through all these different vessels and arteries to map out the same thing that you can get done with a radiology exam. And so, it was a really big investment, but we knew that the clinical outcomes were better because we were able to catch things more quickly. Mm-hmm. We knew that it was going to be cheaper for the patient because a PET scan is going to be way more affordable than getting a procedure done at the hospital.
Because that's a heart cath, right? That's like basically in that where they go in the thigh and do a scope or something, or am I miscalculating this? Or I don't know.
Close enough, yeah. Close enough.
Anyway, the point is that you can do the same thing non-invasively.
Correct.
Right? Okay.
So that's the kind of stuff that we're interested in investing in. And actually, we're one of less than 5 providers in the entire state of Kansas that offers that.
Okay.
So we really want to bring cutting-edge technology to Reno County. And then lastly, also just bringing in more support staff. We know that we have providers that if you need a new patient appointment, you cannot get in for 4 months. And so when we're able to bring in more support staff, we're able to help expand those practices, expand those services, and just continue to provide accessible care to everybody.
And support staff would be?
Nurses, MAs, PAs,
okay.
Exactly.
Okay, very good. So, can we talk a little bit? I know you sent letters out to people, and then one of the things, I would see them, but mostly I would see like people reposting the letters on, Facebook or something like that, freaking out. What was the response from patients in the community?
Yeah, I think similar to businesses, the initial reaction was freak out, but I think there was also a lot of patients who agreed with Hutchinson Clinic and voiced that. We did have several patients who made phone calls to Blue Cross Blue Shield about the concerns of us going out of network. We know that there were patients who wrote letters. We know that there were HR directors that spoke to Blue Cross Blue Shield about their concerns. And we know that there were business leaders and other community leaders that did that as well. And we really do appreciate that support because that we really feel that the relationship between a doctor and that patient is so important, mm-hmm. and we want to maintain that. So we want to thank the community for all the efforts they made in making their feedback known, because that indicates to Hutchinson Clinic that you want to keep your care local and you want to continue to work with your local providers, and that you're willing to put your money where your mouth is, really. And actually, since the beginning of January 1st this year, there are at least 20 businesses that we know of who have switched their insurance from Blue Cross Blue Shield to another insurance carrier. We know that there are a lot of employees who had an option between a Blue Cross Blue Shield plan and a non-Blue Cross Blue Shield plan, and they decided to go to the non-Blue Cross Blue Shield plan. And then there's been a lot of situations where spouses have changed themselves and their kiddos to their other spouse's plan because it was a non-Blue Cross Blue Shield plan. Now, we don't have all the numbers yet. We don't know exactly what everything looks like because not everybody sees us the first month of the year. But, these steps really demonstrates that having a Hutchinson Clinic provider as part of an insurance payer's network is important to you as a patient. It is important to you as a consumer, and that you want to see your local doctors included in your healthcare.
It's an interesting thing to me. It seems that in healthcare and in politics, people like their local provider but dislike the system. Does that make sense? Like the feedback I'm hearing is that people love their doctor. They may be a little aggravated with the clinic. They may be a little aggravated with their insurance company, but they want to keep their doctor. If they have a relationship, it's a very personal relationship too, right, with the doctor.
Yeah, exactly. Yeah. It takes a long time to develop that trust, and it can take a long time to figure out a treatment plan that works for you, and you don't want to have to start that over from scratch.
Yeah. For sure. Now, we talked about businesses that changed insurance providers for some of their employees. Have you guys seen a loss in patients at all? I know it's probably anecdotal, but do you feel like, on balance, most people have said, no, we're going to stay?
We are absolutely running data to see how our encounters are going and how many people are coming in. And I think January has been kind of inconclusive because we just had so many snow days. And I mean, historically, when there's a bad snowfall and there's a lot of ice, less people are going to go to the doctor. And I think probably every business would say that's true this month. But we are seeing more of those patients from those other insurance plans come through, and overall, I really don't think that anything we've seen, as far as the number of patients coming in is out of the ordinary. I mean, we have to account for so many different things, like, we had a lot of providers on vacation because they just survived the holidays, so it's kind of hard to. I think that's always a little bit of a fuzzy question, but overall, there has been no obvious or immediate impact or change.
Okay. One of the things, you kind of mentioned this earlier, and I want to make sure I get back to it and expand on it a little bit. I know I went and visited back in the fall with Colby Sheridan, your CEO, and he talked a little bit about you guys aren't just a family practice center. You have all these different specialties there. Can you talk in a little more detail about how that affects what's going on? You mentioned before with like different positions, but I think it's important to stress that it's one thing if you have like a narrow range of services you provide, but the clinic provides a pretty broad array of services.
Absolutely. I mean, Hutchinson Clinic is really unique because we have such a large group of providers, and it does include your primary care doctor where you just see for your regular stuff. It does include specialists like cardiologists and gastroenterologists and oncology specialists. I mean, we have a wide swath of services, and we actually have a lot of patients travel to Hutchinson Clinic specifically because they are able to see so many providers, different types of providers in the same day. And honestly, industry leaders like Mayo Clinic and Cleveland Clinic say that this is the best practice. So what Hutchinson Clinic is doing is the right thing. But what also makes us different, than a single doctor is because we have so many doctors under our umbrella, we're really able to minimize and distribute the overhead costs more efficiently. I mean, think about it. So as a patient, anytime that you have an appointment with your doctor, you work with 5 different employees. You talk to the person in the contact center who schedules your appointment. You talk to the patient service representative who checks you in, takes your copay, and updates your information. You talk to the nurse who updates your medication and updates your medical history and takes your vitals. You meet with your doctor who, talks to you about your concerns and figures out your treatment plan. And then at a minimum, you don't talk to, but you have a person who's submitting your claims and doing all of your billing for you. That's 5 different employees. A single doctor practice is not going to be able to employ 5 different employees to do those same services. So what Hutchinson Clinic feels, if we're really feeling the pinch on this, then we can't imagine what a solo doctor is feeling with their Blue Cross Blue Shield contract. Because we're in a position where we have so many providers, we offer so many services, we have so many contracts, we can actually cancel a big payer contract like Blue Cross Blue Shield and not going out of business. But for a solo doctor, that's just not going to be feasible. I mean, because again, if we're not able to fully meet the overhead costs, when we're able to distribute it so much, they're not going to be able to do it on that individual basis. And so we really feel like because of that, we're in a unique position in this contract negotiations. And ultimately, if all providers got paid more of higher reimbursement rates from Blue Cross Blue Shield, I think that would be a win.
Yeah. So the decision, look, I want to talk about patients a little bit. The decision does affect the way patients have to navigate their healthcare system. And we talked, Blue Cross Blue Shield has on their website that since it's out of network now, we're not paying Hutch Clinic. It'll come to you. You have to, you guys submit the claim. Mm-hmm. But then when Blue Cross processes it, they're not running it through your billing department as they would have before. They're sending the check to the patient. Now the patient then has to come back and give you the money. Is that right?
Correct.
Okay.
Yeah. So we still submit the claim and the charges and whatever documentation's required. Blue Cross Blue Shield decides, how and if they're going to pay that claim. If there is a payment that needs to be made, that is sent directly to the patient, and then Hutchinson Clinic sends a bill to the patient, and the patient's supposed to use the payment from Blue Cross Blue Shield to pay Hutchinson Clinic.
Okay. Off mic, we were talking before we started recording a little bit about maybe a recent development regarding prior authorization, and that Blue Cross. I want to get into a minute about the information sharing and some of the challenges you're having there. But I want to talk about this prior authorization. Can you explain what's happening there?
Yeah, absolutely. So a lot of times when a patient is looking for a complex treatment, we need to submit prior authorization to an insurance payer to show why this treatment is medically necessary, especially if it's something expensive. So anytime we're submitting this prior authorization, it includes medical records, history, notes from the doctor, and a whole lot of information. We literally have a team that just specializes in this because it's so complicated. So we have continued to, do this service for patients because it's too complicated for the average person. So we submit the documentation, but what Blue Cross Blue Shield is now saying is that Hutchinson Clinic cannot get the information about whether the prior authorization was approved or denied. And so why we feel like this is a problem is in the past, if a prior authorization was approved, that patient went immediately into our scheduling queue. They got a call that day to say, hey, your treatment's approved. Let's get you into office. On the flip side, if that prior authorization was denied, a task goes directly to the doctor. The doctor sees that, calls the patient and says, hey, your prior authorization is denied. Let's look at this other treatment option. Well, when Blue Cross Blue Shield isn't communicating to Hutchinson Clinic what the result is, we're waiting on the patient to initiate that. And I'm not sure how these patients are getting their prior authorization details. I don't know if it's coming through mail or email. I mean, I personally don't check my mail every single night. So it could be several days after it's approved. The patient opens their mail, and now they need to call Hutchinson Clinic between our hours to schedule an appointment, which just delays care ultimately. And so I think we were really concerned when Blue Cross Blue Shield told us that they weren't going to be providing this prior authorization information anymore, because ultimately that makes it more difficult for the patient to be able to actually come in and use their out-of-network benefits if they have them.
So you knew that some things like the paying directly to the patient was going to happen when you made this decision. But this prior authorization, is that something that you didn't anticipate that, did you?
We did not anticipate that. Another thing that's come up that has been really difficult for our employees is through the some patients are now qualifying for what is called continuity of care coverage. So through the Consolidated Appropriations Act, which is a law, when a patient loses their coverage because there's been a network change, like Hutchinson Clinic is no longer part of the Blue Cross Blue Shield network, that patient can continue their care with that Hutchinson Clinic provider if they meet a certain criteria for a temporary period of time. what this criteria is that a patient has a serious and complex condition that, if not treated in a time-appropriate manner, could lead to death, dismemberment, or disable. Mm-hmm. And so one challenge that we're coming up with is we do have some very complex patients that we take care of, and they do want to continue to see their Hutchinson Clinic provider. But Blue Cross Blue Shield is not willing to provide to our staff if a patient has been covered for continuity of care. Again, they're sending that determination to the patient. And so we're waiting on the patient to say, hey, I've received this approval to continue my oncology treatments. Blue Cross Blue Shield is not sharing that information with us. So again, we're concerned that this is really delaying care for those patients who are really sick and don't have the flexibility to wait on those treatments. And so it's just this push and pull of wanting what's best for the patient clinically, but having to jump through these administrative hoops and barriers. That's really what we're struggling against, and I think what's really impacting our staff a lot right now.
Now, when I asked Blue Cross this question, they say we can't share personal health information or this insurance information with somebody we don't have a contract with. How would you answer that?
I think what's challenging about that is when we are asking for a prior authorization, or if we are checking if a patient has been applicable for continuity of care, we're asking that on behalf of the patient. The patient has decided that they want to continue treatment or they want to start treatment with Hutchinson Clinic. We're not submitting this information randomly or haphazardly. It is very intentional, and it takes a long time. So when Blue Cross Blue Shield says, well, we're doing this to protect our patient's privacy, we initiated the request because the patient asked us to do it. Mm-hmm. So the patient is consenting to have them give us the information. I think that's where we're having a bit of a disconnect too.
And in that case, it would be like if maybe I was trying to find this out for my mom or something. If she gave me permission to call her insurance company to find out the details of her coverage, that would be appropriate for them to share that with me. It's kind of similar, a little different because I'm family, but
we would need some documentation on file for that one. You would need to be a designated person to give that information to.
Well, this brings the point, though. You guys assume you guys have that documentation. When patients, are they signing a release that's saying Blue Cross can give me that information?
I mean, one thing that we're just having a hard time understanding why Blue Cross Blue Shield is implementing all of these additional steps, because when we work with any other out-of-network provider, they're not making us do this. We're not contracted with Aetna Medicare Advantage, but when we send them a prior authorization for a patient, they don't ask us if the patient consented us to send that information, and they don't send the authorization anywhere else.
So you're saying, I want to make sure I emphasize this a little bit. When you work with other insurance companies that are also out of network with the Hutchinson Clinic, you're not encountering the same issues?
Correct.
Okay, they're sharing this information and giving you the information you need to work on the patient's behalf.
Correct.
So that, to me, is an indication that this decision is discretionary and not because Blue Cross has told me that the absence of a contract prevents them from sharing this information. And what you're telling me indicates that it is completely discretionary.
Correct.
Okay, thank you. That's because I've been trying to get to the heart of that for a while. Along those lines, another thing I want to ask about was now I noticed on Blue Cross's website they say that there are insurance policies that have out-of-network benefits that, like, I mean, if I'm traveling to Colorado and I am doing the Manitou Incline, which I did not too long ago, but I break my leg, I'm not in network, I'm still going to get some coverage for that treatment of my broken leg, which I hope doesn't happen if I do that again. But like there are like my insurance policy includes out-of-network benefits, and anybody who has that under these circumstances, are they able to access those benefits here?
So there are some caveats, as always. Anytime that you need emergency care, it doesn't matter whether the provider is in network or out of network, your insurance has to maintain their obligation and pay their portion of the cost because it's an emergency care service. Now, the second you step out of the emergency room, can't guarantee it's going to be covered if you don't have out-of-network benefits. So like we said earlier, when you're an in-network provider, you have a contract with the insurance carrier. When you're out-of-network, you don't have a contract. But actually, there are lots of businesses in this community that have plans with both in-network and out-of-network benefits. And we actually did see an increase of businesses opting to have out-of-network benefits, probably because they were concerned that their employees weren't going to be able to see the Hutchinson Clinic providers anymore. So a lot of times, to have these extra benefits, I imagine that you would have to pay more money for the services to be able to have that option on your plan. So what's challenging for us is all these patients have out-of-network benefits, but Blue Cross Blue Shield is making it very difficult for them to actually see a out-of-network provider, even though it's a service that they have chosen to have available on their plan.
Okay, so they have them. It's been made very complicated by the way this is being handled.
Yes.
Okay. I want to go back. You kind of touched on it earlier, and I want to make sure we get back to it. You talked about like just kind of the general cost of healthcare and what's been happening there. Can you talk about that a little bit? I mean, I think everybody who that touches healthcare at all knows that like the premiums for policies have gone up, the deductibles have gone up, the copays have gone up, all the costs have gone up, the cost of drugs have gone up. What is happening there? I mean, at least from your perspective, what's kind of pushing the changes in the cost and the pricing structures in healthcare?
Yeah, absolutely. I really want to dig into the premiums a little bit because I think that is a key part of the whole cycle that gets ignored pretty frequently. That is something that, as a patient, if you have insurance, you have to pay a monthly premium. A lot of times when you're in an employer group, your premium is helped paid by you and also by your employer. So if I did some simple math, if you're paying $200 a month, and let's say your employer is paying $300 a month, that is $500 a month between the two of you. Over a 6-month or over a year period, that is $6,000 total that you are paying for those premiums. When you go and see a provider, if the insurance has some kind of payment responsibility, they're taking the money that you pay from your premiums to actually pay for that medical care. So for example, if you go to do your annual physical and that office visit costs $300, because that's a preventative service, your insurance covers that 100%, they're going to take that $300 from your $6,000 of premiums and pay that bill. So you still have $5,700 of premiums remaining. Let's say your next visit is you need to go to urgent care because you're just not feeling great. You go, you have your doctor's visit, you get a strep test, and then you get prescribed an antibiotic. So if we break that down, let's say that your insurance is willing to pay $150 for that service. So with your plan, let's say you have a $50 copay. So for that service, you pay $50 and your insurance pays the other $100. That's how that one works. Now for your strep test, let's say that your insurance is willing to pay $80. Well, if you have not met your deductible, that's the initial amount that you have to pay before insurance starts cost sharing, you pay that $80 in full. Similarly with your antibiotic, let's say that costs $20. If you haven't met your out-of-pocket, which is the maximum amount that you pay out over the span of the year, then again, you're going to owe that $20. So for that one urgent care visit, you have paid $50 for your copay, $80 for your strep test, and $20 for your antibiotic, so $200 total. And your insurance from your premiums has paid $100.
Yeah.
So when you think about the total cost of care, you're paying $6,000 for premiums, and then you as the individual are paying an additional $200 for the services. So in total, you're paying $6,200 for $500 worth of services. That is a huge gap. And that's really one of the reasons why we have been so adamant about that, is because your premiums are actually paying out your own care. So if you don't like how your premiums are paying out your own care, or if you don't like that your doctor is not in network with the insurance provider, the insurance company is distributing that money on your behalf. It's your money, and so you should be able to have some say in that. Now, I'll give credit where credit is due. One thing that insurance payers do really well is they do pool funds, and they do pay out for, patients that require more serious complex conditions. So, your premiums that you haven't spent for that year, if you have a colleague who is really, really sick, let's say they get a cancer diagnosis, which is super scary and super expensive, what insurance will do is they will take your leftover premium money and apply it towards that cost of care. So that's great. I mean, that's really what insurance is for. It's for those really high cost situations. But what happens is if you have too many people in your group, if you're under an employer plan, that's probably going to be your fellow employees. That's probably going to be maybe you and a couple other businesses. If you have too many people that are really sick in your group, then the insurance will pay out beyond what you've contributed as a group towards that care. But if you have a really healthy population, the insurance company is not going to give you back your premiums, and they're not going to give the business back their premiums. They're going to spend it in another way. So when we're looking at kind of how everything is going to be changing overall in the landscape, we are really concerned because even though our populations aren't changing, you're not going to get more sick people or more healthy people. That's going to stay the same. What we're finding is with our insurance payers, they are going to start moving patients to other more expensive places of care. I know this is going to sound a little biased, but Hutchinson Clinic actually is a low-cost care facility. And the reason why that is because when you see your doctor, you see them in an outpatient office setting. Then office setting is always going to be cheaper than pretty much anywhere else you go. I mean, it's going to be cheaper than a hospital. It's going to be cheaper than an emergency room. It's going to be cheaper than inpatient. I know there was one time where my husband went to the emergency room to get pink eye addressed, and we got a bill for $700, and I was completely freaking out. That would not happen in an office situation.
Yeah.
So we offer a lower cost of care than most places. And similarly, that is true for any time surgical procedures are done. So like when you get, when you need to have a procedure done, we can either do that in the office or we can do that at the Hutchinson Ambulatory Surgical Center. A surgical center is basically a place where you can do, same day, quick, outpatient care, procedures like getting your tonsils removed or getting your gallbladder removed or getting your hernia repaired, those kinds of things. Things
that used to require hospitalization.
Correct.
Yeah.
Correct. So, because we offer those lower cost care, patients really get a huge benefit from that. Like, for example, like you were saying, if you wanted to get your tonsils removed at a surgical center, you're going to pay around $3,000. Well, if you get that same procedure done at a hospital, that's going to cost you $10,000. Now, I mean, ultimately, what patients are going to find is both in the short and long term, they're going to benefit by going to the ambulatory surgical center as an out-of-network patient than paying for that huge hospital cost. Because what the patient will experience is, yes, you're going to meet your out-of-pocket max. You're going to have to pay that $3,000 or $5,000 or whatever it is. But on the back end, now that cost needs to be offset somewhere else. Mm-hmm. So you only had $5,700 that you paid into or $6,000 that you paid into your premiums. You've already used, $400 of that. We're making numbers up. So that money will get applied to your procedure, but now somebody else's premiums are going to have to pay for the rest of that service. And again, your insurance is happy to pay, what you've contributed and up to more, because that is part of their financial guarantee. But if you're constantly pushing patients towards more expensive places of care, at some point, your plan is going to have to change. Mm-hmm. You're either going to have a higher deductible, you're either going to have a higher out-of-pocket or higher premiums, because the insurance payer doesn't want to pay more than what you're contributing every single year.
And that's what we've seen over the last decade or so, is that the premiums have gone up the deductibles have gone up, all those things to kind of offset that.
Exactly. And so what's concerning is we are able to offer all these different specialties, all these specific procedures at Hutchinson Clinic, which again is a low cost of care comparatively. But to receive those services almost anywhere else, you're going to have to go to a hospital-based system. So while you may be saving a little bit of money in the short term by seeing an in-network provider, in the long term, that is going to contribute to the cost of care going up in general.
Okay, so talking about that a little bit, one of the things that I think is the biggest frustration for patients in the town is not being able to get like a clear picture of how much more it will cost them to stay with the clinic and be out of network, which is the information you're trying to get Blue Cross to help with, but they're not being very cooperative on that. How are you guys managing that right now with people?
Yeah, I think it's really hard because, I mean, again, these are really complicated topics. And, you know, the average person, like you said, just wants to know the cost. They just want a simple answer. So in the past, our estimates team has been able to say, okay, this is our cost. This is how your benefit plans are. This is what you need to pay. Let's let's get that number out there so we can figure out how we're going to address it so you can get your treatment. Right now, what's being required is, well, Hutchinson Clinic can give you the cost that we're going to bill, but Blue Cross Blue Shield can't tell us what they're going to pay based on your benefits. So now patients need to make a call to Hutchinson Clinic, they need to make a call to Blue Cross Blue Shield, then they need to do some math, and then they maybe get an answer, assuming that they understand every single one of these terms and how everything interacts correctly. I mean, that's not very transparent. And really, we feel like it's a benefit for patients to be able to know that information. And again, other out-of-network providers or other out-of-network insurance carriers allow non-contracted providers to have this information. They're willing to share it. So it really just seems like an unnecessary step.
Yeah, it seems like it's just a barrier. Another thing I wanted to ask you about, I want to go back and kind of touch on a little bit. This long-term sustainable future health of the clinic and the healthcare infrastructure in Hutchinson. Are you hopeful, or is the management of the clinic hopeful that there will be another opportunity to sit down with Blue Cross and have this conversation again after this decision, or are all the bridges burned?
Honestly, I'll say this. We negotiate contracts frequently and regularly. So if Blue Cross Blue Shield comes back with a great deal or something that's reasonable, we're happy to work with them because, again, that is part of our annual process. So it's certainly not out of the question, but we really do need to work with insurance contractors who are willing to invest in local providers and invest in our community and make sure that our practices are sustainable.
Well, yeah, that's what I'm trying to get is like, if you're successful in this endeavor and we look 5 years down the road, like help me understand what the clinic looks like 5 years from now if you're successful in this versus what that might look like if you continued to operate under, I guess what you're describing as insufficient payment from Blue Cross Blue Shield. Like what sort of things would you have to change to make that business model work? And what sort of things will you have to change to make this business model work?
I mean, ultimately, I think what it comes down to is if you had a business partner who said, we're going to sell this product to you, but we're going to charge you $100 for this product, but you can only sell it for $80. So you have to take a $20 loss every single time you make this product available to a consumer. You would not be in a relationship with that business provider anymore. And that's kind of where we feel like we're at with Blue Cross Blue Shield. And I think really this is an important conversation, just not for Hutchinson Clinic, but for the entire Reno County community, because ultimately when your care is local, that you're going to continue to keep your businesses local as well. You know, when folks are forced to go out to different cities for their care, they're going to find other opportunities to spend their dollars. I mean, I myself work here in Hutchinson but live somewhere else, and I buy my groceries here, I get my haircut here, I get my gas here, I do everything in Hutchinson. And so if I'm a patient and I now need to go to Newton to get a service done, am I going to continue to get my prescriptions filled at Medicine Shop, or am I going to go to the pharmacy that is in the same building as my new doctor's office? If I'm a patient who now needs to go to Wichita every 3 months to manage a really complex condition, am I going to continue to buy all of my groceries at Dillon's, or am I going to look at getting a Sam's Club membership and maybe buying more stuff there? If I now need to go to Salina to see a specialist and I really want a coffee because that was a stressful doctor's visit, am I going to wait 65 miles to come home to go to Metro Coffee, or am I just going to go to Mocha's?
Yeah.
I'm not saying there's anything wrong with these cities or these different businesses, but when you're forced to travel other places, you're going to start looking at those options. And so we really feel that keeping care local and keeping your providers in the same area it's not only good for us as the clinic, but it's good for us as the community and sustaining all of our businesses.
That makes sense. Another thing I want to I guess talk more back on patients a little bit more. One of the things that I think there's a little, we talked about this at the top of the recording. There's a frustration with people in the community, right? There's a lot of you guys should have known that these things were going to go this way. And why didn't you know that? And why did you do this? And this is messing up my life. And a lot of patients, frankly, and I think rightfully so, don't necessarily care about, they care about seeing their doctor. They don't necessarily care about your business model, right? I think that's a fair statement.
Sure.
They're just trying to get care. But I guess to talk, if we're talking to the community, what do you want them to know about this decision? What do you want them to know about what you're trying to do for them? Just kind of generally, I guess, an overview of the clinic's position. There's been a lot of things. I see a lot of things on Gossip Hutch, which is the whole thing, but and the chatter out there, and people are rightfully concerned. This is they're getting caught in the crossfire between insurance company and a medical provider, and it's a system that they're just trying to navigate. So talk to them and say this is we've been talking about it, but what do they need to know at this point?
Yeah, absolutely. We know that there's been so much stress and frustration around this whole process, but ultimately what we want our patients to know is that, first and foremost, we are going to make sure that you continue to see the best care possible, because we want, if you want to stay with your physician, we want you to be able to keep that relationship with a doctor that you trust and you feel like has your best interest. As far as it goes with Blue Cross Blue Shield, we are going to continue to do the best that we can, but ultimately it is up to them who is your insurance payer. If you have out-of-network benefits or continuity care coverage, we are more than happy to jump through any hoops they throw our way to make sure that you're able to actually utilize those benefits and be able to take advantage of our services. But, so we're going to continue to give you your cost information. We're going to continue to complete your prior auth, submit your claims to the best of our abilities, but there are going to be restrictions that are placed by Blue Cross Blue Shield. And I really think it's important to, again, reiterate that this is your insurance plan. Your premiums pay Blue Cross Blue Shield's paychecks. And so if you feel like that your insurance carrier is not meeting its obligations to you as a policyholder, they're not giving you your benefits, then I really recommend that you report it. Report it to Blue Cross Blue Shield. Let them know that there's a problem. Report it to your HR department. Let them know you're not happy with your plan. And if it really gets bad, you can always report it to the Kansas Department of Insurance too.
Yeah. In the meantime, you're willing to help people through this process. Is that right? When they're trying to get prior authorization, you're going to help them do that. You kind of, part of this decision was to restructure a little bit so that there were, I believe I'm right, and there's more people to help them through this process.
Absolutely. Yeah. We developed the Patient Advocacy Center specifically to help people get through this transition. And, really at the end of the day, insurance companies don't provide your health care, your actual doctors do. And so our doctors are going to keep championing our patients because that's really fundamental to our business. We are unique because we are a physician-owned and operated organization. We allow our physicians to practice their medicine how they want to, and don't put restrictions on them as a health organization. So the decision between you and your doctor and how you want to get treated is what we're going to make happen, whether that is a super expensive $75,000 oncology drug for a really rare form of cancer. That's what we're here for. That is our goal, is to give patients the best care possible. And Hutchinson Clinic has been caring for you and your families for 65 years and is going to continue to do so. We're going to continue to support our local community. We're going to continue to support our businesses and organizations, because ultimately this is our home too. So we do want to thank you for trusting us with your care. We know that this has been difficult, but we really are here to continue serving you both now and in the future for many more years to come.
Well, thank you for coming in today. And I know that was a lot of information. It was a lot of information for me too, but I really appreciate your expertise on this and appreciate the opportunity to get the clinic's side of the story on this. I think that it's a complicated issue and it's an important issue. And so I'm really, really grateful that you were able to come in and sit down. I probably later will think of all sorts of questions I should have asked or wish that I would have asked. So I may call you and ask you those offline, but I really appreciate the opportunity to visit with you today.
Yeah, absolutely. Thank you so much for having me. I'm really glad that I got a chance to speak with you today.
Yeah, thank you.
I'd like to thank a few of the people who've helped make That Podcast in Hutch possible. My son Mitchell Probst wrote and recorded the music for the show. Jenny Brigette put together some great graphics and promotional art. And Chris Acker helps overcome my mistakes to produce a great sounding product every episode. That Podcast in Hutch is made possible through a collaboration between the Hutchinson Arts and Culture Collective and Salt City Sound. They're working to bring resources and infrastructure to support art, music, and storytelling in our community. If you have an idea for your own podcast, reach out to them at podcasts@saltcitysound.net. If you enjoy That Podcast in Hutch, be sure to subscribe and share it with all your friends. You can also help support this production by subscribing to thatguyinhutch.substack.com or by emailing me at thatguyinhutch@gmail.com to learn about sponsorship opportunities. Thanks for listening, and I hope you'll join us again next week.
A Salt City Sound production.